Talking about total cholesterol. Most of the time we could say things like what's good for the heart, typically in terms of LDL and HDL, is good for the brain. And there's some research to support it, but all the research I'm going to share with you and the clinical cases are the levels of total cholesterol associated with depression, substance abuse, and suicide. Okay, now let's just take a step back. And why is cholesterol so important for mental health and mental illness? Well, the brain is the fattiest organ in the human body. 60% of the dry weight of the brain is fat. And the brain is the most cholesterol-rich organ in the body. Now, most of the cholesterol that is in our bodies is manufactured in our liver, and only 15% comes from the food we eat, which is often missed point. But cholesterol is so important to human physiology. I just have a few slides to kind of hit home this point. So as a molecule, it's critical for cell membranes. It regulates the fluidity and the stability of the membrane. It assists in what we call these lipid rafts for support of receptors, and it's critical for myelin, which helps the brain move. But then we get to things that you and I talk about every day. Just don't use the word cholesterol in this sentence. Cholesterol is required to make vitamin D, ultraviolet light on the skin, and a cholesterol molecule, we make vitamin D. Cholesterol is the precursor to every steroid hormone, every sex hormone, which are steroid hormones. So think about it: estrogen, testosterone, cortisol, and there are pregnenolone, DHEA. These are all derived from cholesterol. So think for a minute. You don't have enough cholesterol, you're not going to make enough vitamin D, you're not going to make enough estrogen, testosterone, DHEA, pregnenolone, the cortisol, the list goes on and on. Estrogen receptors, serotonin receptors, GABA receptors, all dependent on cholesterol. So the punchline here is just the brain is fat. The brain is made up of cholesterol. Every aspect of neurotransmission requires fat, cholesterol, and the essential fatty acids. And the essential fatty acids have gotten a lot of press over 30 years. EFA deficiency is associated with anxiety, depression, allergies, suicide, psychosis. The list is endless. Cholesterol has not gotten the press. So here we continue. The other thing I didn't mention, bile salt formation. So how do we digest our fat and absorb any of our fat-soluble vitamins? Activating oxytocin and serotonin receptors. Cholesterol is involved in all aspects of brain function. Essential for life. Okay. So suicide. Every 12 minutes, someone in the US dies by suicide, and then the families are left to try to understand it. And whether you personal experience or any news story, we always hear, nobody really can make sense of it. And I just use this as an example of our model of treatment in the United States. This is a metal net, almost $300 million on the Golden Gate Bridge. They're building to deter suicides from this one site. I think it's just a kind of ludicrous example of our model of prevention, which might help around the bridge. I'm sure there'll be less suicides. We have metal nets in China and other parts of the world that do work. People don't jump on these bridges. No one wants to jump into a metal net, but suicide rates continue to escalate. This is not the answer. So understanding serum cholesterol, again, suicide tendency, psychiatric inpatients, 1994. The lower serum cholesterol, higher suicide rate, not influenced by any of the other factors, including physical health.